Hi, my name is Jessica Palacios. I'm a student at CBD College in the Surgical Technology program, microbiology class. I will be reporting on the preparation of the operating room for Ebola patient. Why does the OR need to be prepared for Ebola? Developed nations, such as the United States, will have very serious interventions that are consistent with healthcare workers being exposed to infectious particles. Since Ebola virus infection has been cared for in the United States, it is possible that a patient with Ebola virus disease may require surgical intervention. It would be unethical to not be prepared to provide surgical care for a patient infected with EVD. It is serious that healthcare facilities be able to protect their staffs as they provide high-quality care to every patient. Most ORs in the United States are able to technologically provide surgical intervention for an EVD patient, but lack sufficient personal protective equipment, PPE, for staff members. Facilities may not have specific equipment that are currently recommended by Center for Disease Control, CDC, and American College of Surgeons, ACS. Examples of equipment: N95 respiratory mask, level 4 protective gowns, fully enclosed protective suits. Due to the two nurses who contained the infection with caring for the deadest patient, the CDC has promised to send support team to any hospital in the U.S. with a patient with symptoms of EVD so that they can lead an effective and safe response in caring for patients. A patient with Ebola should not be scheduled for an elective surgery. Any surgery intervention would be considered emergent or urgent. OR members must be trained and have enough practice with donning and doffing of specific PPE used providing surgical care for a patient with Ebola. Staff must be able to put on and remove these components without contaminating themselves. Preparing OR for an Ebola patient. Staff must prepare the OR for the arrival of the patient. Both circulator and the surgical technologist need to consider the nature of patient and perform appropriate preoperative planning for instrumentation and supplies required. It is important to remember any equipment to remove any equipment that will not be used. Only supplies necessary should be exposed. Surgical instrumentation on equipment.